Well, hello there, friends. This is Sheena Collins here with Sheena Strong, and today we are going to um, talk about a little bit about the chronic pain. So, we know that this Sheena Strong stuff all started with the breast cancer, but my journey is more than just breast cancer, and for those of you that don't know, I have been a migraine sufferer my entire life, since it's as far back as I can remember. And you have to excuse me if the video is shaky. Jack, off the bed. Off. I had dogs moving around. Okay. But anyway, back in 2015, I underwent an angiogram to assist with my migraines. My beginning journey started with orthodontics, and because a lot of times that's enough to relieve a chronic headache condition, and an option a lot of people don't explore. So I had started with an orthodontic. I went to some really good orthodontist. Sawyer Creek Orthodontics in Oshkosh, Wisconsin. And they worked with me, and there the staff knows the doctor, Dr. Maslowski is my orthodontist there, and they know that oftentimes your bite, if you have an overbite or if you grind your teeth or if things are off, that is often enough to give you headaches. And the same thing goes with chiropractic treatment. But at the time, I was undergoing acupuncture, chiropractic treatment. We tried the orthodontics, and it did not work. And through that, we did an angiogram to do more exploration. That's where they go in through your femoral artery in your leg. They run a catheter all the way up to your brain, and they shoot a chemical in there that lights up on an MRI machine and points out differentiations. Anyway, I have an arterial venous malformation in my brain. So I have an artery that's one of the main ones, and it's snaked in there. So it's supposed to be straight up and down. And I don't know if some of these headaches are related to that or not. Anyway, I've been under the treatment by a neurologist for that. And through that, I developed chronic pain. Now, I am still in the throes of managing my chronic pain. I think that I have done a good job at getting to a point where I can manage it. Now, I do manage all of my chronic pain without the use of any medications. Sometimes I do have a couple of emergency, I'm having a serious migraine attack, pills. I do, however, will let you know that, depending on what your definition of medication is, I also do give myself the Emgality shot once a month for my migraines. And then I also receive infusions in neurology where they take a needle and they go in and they inject along my lobes here. And then I go to the pain clinic and they inject in the occipital lobe nerves in the back of my head. I get injections in my neck and all down my back. And these are steroid injections. And I have some concern because I've recently been diagnosed pre-diabetic. And I have some concern about steroid use because those are steroids that they put in there. But anyway, the point of today's story being is that treating these conditions so that you can live and function normally can be very, very difficult. For me, medication seems to slow me down. All I take on a daily basis for medication is the tamoxifen for my triple positive breast cancer treatment. And then I take propranolol. I have a condition called tachycardia where my heart beats over 100 beats per minute at all times. And so that slows that down. And that's really critical. And also part of the headache management, the pain management. So there's this big ball of wax. And then, we threw the cancer right into it. Anyway, so today, as you can see, I have right here it's noticeable. It looks like a line, and like somebody stuck their thumbprint right there. Now when I press on that, I can feel it tingle all the way up through my head back into here. And this happened after my last injection. I've Googled a lot of things. I'm not going to put it out there. I'm not a doctor. I have not been diagnosed by my doctor with this yet. I have upcoming appointments with my pain doctor and neurologist, but it has something to do with the nerve and the tissue surrounding it. Anyway, it was really bothersome to me, and I thought that night that it was after the injections that it was just irritated. I had some oddness in my vision because they actually go in all the way behind my eye into the occipital nerve or into your nerves behind your eye, the four that like attach and the muscles, and oh my gosh, it's unbelievable what they do. But anyway, I've been treating this area. From what I read is a lot of times there needs to be a tissue filler, but what I'm using is this little device from Mary Kay. I don't know if Mary Kay still sells these or not. This I got with a product from my Mary Kay representative, Shelby Helms here in Westfield, Wisconsin. If you need a Mary Kay lady in our area, she's amazing. But this device is meant to use your skincare to roll in. And I thought, well, maybe I just need to activate that area. So I roll over it and I can feel that tingle up here. But what we've decided to do is, since I feel that tingling, and this is kind of problematic, I have a prescription lidocaine cream. You do need to go to your doctor to get a product like this. And I work constantly. I'm almost actually there is not a week that goes by that there's not something that I have to use my chart which is an electronic form of communicating with your doctor. I can send them messages to communicate with my medical care team. So I'm about to put this rub this into here and work over this area. And I'm going to talk to you about that in a minute. First, you want to make sure that your face is clean. I've been recovering from surgery on August 18th, so a lot of bed rest. And one of the things I will tell you is if you are primarily alone during any recovery from a surgery, as you can notice, hang on one second. Off, get off the bed. Okay, sorry, dog. One thing that's really good to keep is beside your bed, if you are stuck on a lot of bed rest, is some facial cleansing cloths. These ones are called Refreshments Cleansing Wipes, and they come in a 30 count package here. I'll post the links below for these products I'm using. And you just want to make sure that my skin is clean, simply because if I'm using any kind of medication or topical solutions, with the breast cancer, and still the chemotherapy is still in your body, even though I've been done with chemotherapy since February of 2022. It's radioactive material, so it has half-lives, and it has to work its way out of your body as your cells reproduce and regenerate, because chemotherapy is massive cell death. It kills every single living cell in your body in an attempt to kill the cancer, and then your body basically regrows. Our cells as adults, they do regenerate every 7 years, and what chemotherapy does is it accelerates that process. Okay, so my face area is clean. Now, I was advised by the pharmacist to not get this in my eyeball. So, and all it is just a cream. And they do sell you can buy this over the counter. It's in up to a 4% solution of lidocaine. So I'm going to take over this indented area because, like I said, if I push here, I can feel it tingle all the way up in here. So I'm going to put a little bit of this on my brow, not very much because this stuff is prescription and it's strong. And I also have pain from that nerve all the way up here into my forehead. So I'm going to rub a little bit. You can see that nerve and that line right there. And I'll post some pictures also too that show that nerve. All right. So I'm going to rub this in. And one thing I noticed, and I'm wondering, is if perhaps I'm developing scar tissue. I just realized I need to get my eyebrows done really bad. All right, the Mary Kay rose quartz roller. Oh, it's so beautiful. Even the handle is a rose quartz, and it has a natural rose quartz stone, which is a healing stone in itself. Okay, and then what I want to do is I'm just pushing over this area and rolling over it. And as I do, what's interesting is I can feel and hear some crunching, but this depression in my forehead that you see is certainly a lot. It's lessened since my injections, and my injections were about 3 weeks ago. I go every 3 weeks for injections in different parts of my body. So 1 week it'll be in neurology, up or in my brow areas and behind my eye. And then on other weeks, it'll be the pain clinic, and they'll do the back of my head, the back of my neck. And then also other times it is in the hospital, in the surgery center, where under ultrasound, they do all down my back. I'm hoping I'm a candidate for a nerve ablation surgery. That means I won't have to go get injections all the time. Like I mentioned, I do have some concern that my pre-diabetes diagnosis is related to steroid use. But let me tell you, before that frightens you, I am very predisposed to pre-diabetes. Like, I won the lottery with all of the things that you can inherit that you don't want to inherit from your family, from both sides. Okay, so I am rolling this, and as I do, I can feel where that depression is, and as I roll over and push and apply some pressure, I feel like a crunching, and there's an irritation of that nerve, and I get these like little zingers, and that lidocaine cream is supposed to stop that. But I do feel that using this is helping alleviate any pain that's being caused in this area. It's been very sensitive since the procedure, and it's just one more thing I don't want to deal with. But this lidocaine is going to make that nerve slightly desensitized so that when I do this, I can feel. And I can feel right here, there's a bump and there's a bump. And as I've pushed over those, it's almost like it's scar tissue that's built up in there. And I could hear it crunch when I was doing some forehead massage and a tapping technique that I learned for chronic pain management. And I'll discuss that in another one of my videos. I'm just getting back into my healing videos. Anyway, so I roll this over the area. I want to stimulate that. Basically, I don't know. Until I get a diagnosis, I think it may be scar tissue. It's also that muscle maybe being too relaxed, or a lot of all sorts of medical things that can cause this. And it's, but mine, I believe, is just from that nerve is angry. It's always angry. And this nerve runs all the way down and through here. And it's part of the reason why I have my chronic migraines. But this feels really good. To use this and roll over that area. And as you're rolling over an area like this, you're also bringing blood supply into that area. Anytime you apply pressure, heat, you're allowing capillaries to open up and create flow. And yes. So that is one little thing that I noticed. And as I further investigate this with my doctor, I see my care team this week, part of it. We're going to look into this more, and I hope that this is not permanent. I guess if it is, I'll just have to wear bangs the rest of my life. No big deal. And now I'm actually feeling like that nerve's been affected a little bit. I can feel some different tingling and a numbing sensation. But I'm working with this. I will let you know how my progress goes. And so I just wanted to share a little bit about, sometimes we don't know, if you're having a personal battle with, a chronic migraine condition, a chronic pain condition. These are invisible disabilities that you do not see. And that's what makes it difficult, because it takes a lot of preparation and time and a lot of healing and downtime to be able to go out and function in this world. And that is, so this is just a little bit of a behind the scenes look at some of the things that I do, or that I'm doing to help with this chronic pain condition, and this activating this nerve as I go over this area. I'm really hoping that this area will work its way out, and I don't have to do anything like getting tissue fillers put in there. And I already get poked and prodded enough. And anyone that struggles with any chronic medical condition already knows this. And but don't give up, because if I can find a way to work, regardless of all of these health matters that have gone on with me, I believe you can too. We just have to find out a way to do it. And medication is not always the answer, and there's nothing that comes in a magic pill. And often we just cannot have control over what we're afflicted with because of our genes and what we inherited from our parents. And that happens to be my case with a lot of things, other than the chronic pain condition, but that was caused by a medical device that ripped out of my leg. And so that's interesting. But I just wanted to show the rose quartz roller and what I'm doing. I wanted to show the little depression and just let you know, my goal of Shena Strong is to educate about these things and to try to help you live the best life possible. And I really believe that with food, good diet, exercise, all of these things, that we can really often work to, plus mindfulness practice, meditation, focusing on breathing, that we can find ways to combat our pain, accept our pain, and find ways to live in the world and accomplish what we want. We may not be able to live like everybody else and be able to attend all functions and, live a life like I used to remember living before this. But what you can do is give yourself self-care and do the things that will, you have to prioritize what's important for you. And I did this a long time ago. I had to, back in 2015, prioritize what my priorities in life were, what I was striving for, what I wanted to be healthy for, how I could find a way to work without according to my needs, because I go to the doctor a lot, and I've been going to the doctor. I'm so wrapped up in that medical system with my treatments, and I'm glad it's there. I'm not anti anything medical, but I do believe that it works in conjunction with other forms of healing, such as mindfulness practice, yoga, stretching exercises, physical therapies, getting fresh air, being out in nature, as God intended us to be. And also by making yourself in a position where you feel healthy enough, where you can also be social and participate in your community, because those are things I believe that make us whole as human beings. So I'm trying to bring to you and what is working for me. And I'm not saying that I do all of this all naturally, and all I do is breathe and do yoga and pray and, I'm all la-di-da-di fine. No, that's not the truth. The truth is yes, I do all those things and I practice those things, but I also have backups, because trust me, anybody that has had a migraine ever in their life, it is the most awful thing ever. And I have migraine symptoms every day. Fluorescent lights really bother me. I'm very light sensitive. And I don't know if you've ever put on sunglasses and looked at overhead fluorescent bulbs, but you can actually see them flashing. And that triggers migraines. And that has, those lights have been a problem for me since I remember them even bothering me as far back as junior high. And that was a long, long time ago. So, yeah. And, but I do have those backups, and I do still get infusions at the pain clinic, but I'm hoping to find a way to stop those. I'm on an eternal quest to learn how to live and function and have the fullest life possible despite all of the things I deal with. So if you're feeling overwhelmed, you're not alone. I mean, granted, my sickness and illness is not yours. And sometimes I, even feel guilty for complaining about mine, because I know people that have debilitating medical illnesses where, it's affecting their whole body. I think about people with MS and the way you literally have no control and you start to lose control. And there's nothing you can do about it at this time, but they are making advances every day, just like with my cancer treatment and with the pain. So don't give up. I hope that this inspires you to try to also live your best life possible as you sit here and watch me use what's supposed to make me beautiful, help me medically, right? That's it. I wanted to just share, because I am on an eternal quest to make sure that I can live my fullest life moving forward. And for those that are wondering, I am no evidence of disease, which means I'm malignant tumor free. So that gets kind of confusing when I say that I'm still being treated for cancer, but I'm using the drug tamoxifen to prevent reoccurrence of the triple positive hormonal breast cancer that I have, because basically my cells have these receptors that glom on to estrogen and progesterone, and then I have what's called an HER2 protein, and that won't let my body release those naturally produced hormones in a proper fashion, and then they start to turn cancerous. So I am in a state of what's called no evidence of disease. So when I say cancer-free, that's what I mean, is no malignant tumors, and the tamoxifen, and I'm still, in treatment for cancer with the tamoxifen drug, which I have to take for 5 years. And often now they are extending that out to 10 years. And that is what keeps my cancer medically from reoccurring. And like I said, I believe that there's a place where modern medicine and ancient forms of healing, plus all the things of exercise and diet, when we weave those together, I believe that we can heal our bodies the best we can. Some things we can't heal completely from. But that's where I'm at. And I just wanted to share with you today, because I know that in my page, as I grow and evolve, the Shena Strong program and the advocacy and the education and the sharing, this feels good. It's like an extension of when I used to teach yoga, an extension of when I used to teach meditation. I used to have so much fun. I would teach a senior yoga stretch chair class at our local village hall. I did a program at our local library, and ever since I was in high school, I've done some sort of community park and rec. And right now, I'm bringing you these videos. Of course, they're rather rough, and I hope as we go forward, I will have better produced stretching and yoga and other things for you to do. But don't do anything without your doctor's permission. I did show my doctors what I was using, what I was doing, and, they help guide me in my self-care. Okay. All right. Blessings for really good healing for all of you. I hope everyone is doing well. And thanks for watching and letting me run my mouth. If you want to hear more topics about how to live, starting to live a better life, form habits, heal. You can check out my Bantering Fool podcast. And if you would like to support the Shena Strong cause and all that's affiliated with it, I'll also post in the comments a little bit about everything like that. All right. Thank you for watching. May good health be yours. May God shine upon you. May the universe rise up to meet you. And may you go out there today and be the best you can be today, despite wherever you are at in life, as I shake my Mary Kay quartz roller at you. All right. Shena Collins with Shena Strong, signing off. Peace and love, my friends.